Tonight we begin our special report, Code Black, Opioids on the Suncoast. The state and local political response to the war on opioids began with an attack on prescription drugs. But good intentions sometimes have unintended consequences. SNN's Grant Boxleitner explains.
To understand the full scope of the opioid crisis in Florida, it's helpful to recall what was happening on the streets as we started the decade.
We saw a lot of things like OxyContin and various types of oxycodone-related products.
And these prescription drugs flowed to users through doctor shopping, pill mills, and other illegal means.
It's where you had unscrupulous, prescribers kind of flooding the market with a lot of these pills, and very easy to get prescriptions from certain places.
Sarasota Memorial Chief of Medical Operations R. Stephen Taylor remembers those days in the emergency room.
I think for hospitals all around the country, particularly public hospitals, the big thing there was this. It was literally an epidemic, an explosion of overdoses.
State and local governments responded by attacking the supply of prescription opioids. Zach Anderson covers the legislative session for the Herald Tribune.
And you saw a big effort statewide to try and crack down on some of these pill mills. A huge concerted effort from the state, local on down to try and rein these in, and they were successful in cutting off a lot of the worst actors.
The state approved a prescription drug database in 2012 and made it illegal to prescribe opioids directly from pain management clinics,
which really put a damper on those physicians who were outliers, who were prescribing mass quantities of oxycodone for these patients.
But as the supply of prescription pills dropped, along with overdoses,
the crackdown 7-8 years ago was a move in, I believe, the right direction, but at the same time it might have had some unintended consequences.
The opioid crisis was emerging on the streets in a new form.
The prescription supply went away, but the demand didn't go away. And what you've really seen is a lot of people turn to street drugs and to getting their drugs, in more illicit means.
It started with a flood of heroin and then a dangerous synthetic opioid, fentanyl. Frank Alcock is a New College political science professor.
And then fast forward a few years later, we introduced now fentanyl into sort of the heroin family, and that's where you have, boom.
State and local governments are now fighting a new battle against opioids.
They keep addressing the supply. One thing that they haven't done a great job is addressing the demand and trying to help the addicts and get fewer people addicted to these drugs.
Reporting in Sarasota, Grant Boxleitner, SNN Suncoast News Network.